that announcement from the governor's office. Some of those long lines hopefully will be getting a little shorter. The governor now deploying California National Guard to testing sites across the state. The goal is to get more people tested for COVID faster. The video his office shared with us tonight. You can see members of the California National Guard arriving at a testing site in Antioch. This is at the community center on Lone Tree Way. Now, on Monday, that site will be able to double the number of appointments it offers each day. Not just Antioch, additional sites in Contra Costa County, as well as Alameda, Santa Clara, and Napa, will also be receiving help from the National Guard. More than 200 personnel will be deployed to 50 community testing sites overall.
This morning, we have new details on which hospitals the state is deploying the National Guard to help out with those healthcare workers who are just so at their breaking points right now with the demand brought on by the virus yet again. About 100 personnel will help testing sites in the healthcare districts you see right there on your screen. That does include Cobb, Fulton, and DeKalb counties. Another 100 guardsmen will support 11 hospitals as well. Locally, that's going to be Grady, Wellstar, and Piedmont Henry.
Right now, hundreds of Maryland National Guard members are getting ready to help end the state's COVID fight. They will be instrumental in expanding testing sites across the state. WJZ investigator Mike Kellgren is live at the Armory in Dundalk. He got rare access to the preparations today. Mike?
Vic, you know it's a big deal when the National Guard is deployed, and the governor did just that when he declared a state of emergency earlier this week. We did get a look at the training here today as they try to keep safe themselves.
Now you'll want to sanitize your hands again.
These are some of the 1,000 Maryland National Guard members who are on the front lines in the fight against COVID-19.
You're just going to be walking around normally to make sure, like, during your regular day activities that you don't break your seal, you don't taste or smell anything, okay?
They're getting fitted for special masks to keep them safe at testing sites.
Pull and roll.
And learning how to properly take personal protective equipment on and off, from gowns to gloves.
Now you'll have to put on a new pair of gloves.
We spoke one-on-one with Brigadier General Janine Burkhead, who's helping lead the efforts.
It's a huge undertaking, and remember, we're doing this in a COVID environment. We're very conscious of the fact that our soldiers come from the community, and we're bringing them in, again, off of their full-time employment, very short notice.
National Guard members will also be assisting hospitals where emergency rooms are strained. They've already helped set up testing sites in Anne Arundel and Harford counties in just 48 hours and are poised to assist at many of the 20 other new testing sites opening this month.
We understand that that's been a heavy burden, the testing, particularly coming off the holidays, kids going back to school.
This is why I said make sure your gloves are the right size.
Learning how to administer tests the right way is critical, as these Guard members will be doing it thousands of times in the coming weeks. That's the training you're seeing here.
You're going to present the swab to your patient, right?
These members of the community are now back in active service as the state deals with record high infections.
Every day, come in with the PPE on, their mask on, and subject themselves to maybe to someone's COVID positive or not.
And the general pledges that everyone will be treated with dignity as we all get through this together. The governor has said the next 4 to 6 weeks will be the most challenging of this pandemic. Reporting live in Dundalk, Mike Kellgren, WJZ.
Well, close to 200 National Guard members are being remobilized to lend a hand on really all fronts as the state continues to deal with the latest COVID surge. Now, these reinforcements are headed to testing and vaccination sites all across the state, with some already in action in places like Central Falls. The governor says that they're also working to send troops to the state's hospitals, which are in the middle of dealing with a staffing crisis. Governor McKee says he saw firsthand the stress and pressure inside the emergency department at Rhode Island Hospital, telling us right now they're over 100% capacity.
The description that we've heard from the, from the emergency physicians as well as the head nurse that was walking us through, they were certainly describing a stressful issue. It's stressful because of staffing. They're about 113% of capacity, but the capacity is about 65% of their normal capacity because of staffing.
Now, to provide some more relief, Governor McKee says his team is working on opening up more urgent cares as well as speeding up the discharge process at area hospitals. In the meantime, the state continues to ramp up testing and vaccination clinics with a handful scheduled throughout the state today. Those community-based clinics like the one behind me here in East Providence on Taunton Avenue. We have more details right now on our website, WPRI.com. We're live in East Providence this morning. I'm Kayla Fish, 12 News.
Hospital spokespeople are telling me that even though the initial indications are that Omicron is a little less severe, the sheer number of additional cases translates to more patients in the hospital. But for Northwest Arkansas hospitals, Mercy and Washington Regional, testing help is on the way. While the demand for tests is through the roof, 6 National Guardsmen will be deployed Monday to help each hospital. Washington Regional sent us this statement saying in part, quote, "This additional support will allow us to more efficiently test community members and communicate test results in a timely manner. This assistance will also allow us to utilize our current testing staff to provide additional needed direct patient care during the current surge." Washington Regional also changed its visitor policy this week. Dr. Dillahay at the Arkansas Department of Health says that's not the only adjustment hospitals are forced to make.
They are cutting back on elective procedures so that the staff who would be taking care of those people can then take care of people who are admitted to the hospital.
And according to officials at Mercy Northwest Arkansas, they're also busy swabbing patients. In a statement, Mercy said in part, quote, "Despite the challenges of this surge in cases and testing, Mercy remains committed to serving our community. In the meantime, we ask that you prepare for a longer than usual wait time to be tested." Cole Zimmerman, 4029 News.